Hey everyone. If you or someone you care about is about to head home from the hospital after a procedure, then you are in exactly the right place. Let's jump right into your guide for a really great recovery.
So, you're finally discharged. You get through your own front door, drop your bags, and then it hits you. Now what? It is such a common feeling, right? That whole support system of the hospital is suddenly gone, and you're the one in charge. It can feel a little daunting.
Well, don't worry, we are gonna get you sorted out today. Just think of what we're doing here as a new memo for your health. A simple, clear guide based on advice from experts to help you get through this really crucial next step.
So here's our plan. First up, we're going to talk about the main challenges you're likely to face. Then we'll get into the specifics of how to manage pain the right way. After that, we'll cover staying safe and strong because you do not want any setbacks. And to wrap it all up, we'll put everything together into a super simple recovery blueprint.
Okay, so what are the biggest hurdles you're really up against when you get home? Well, it pretty much boils down to two key things that can honestly make or break how well your recovery goes. I mean, the goal is pretty straightforward, right? You want a smooth, confident recovery in your own space. But standing in the way are two major risks. First, managing that post-surgery pain correctly, and second, and this one is so important, preventing any falls or new injuries that could send you right back to where you started. Let's just tackle that first risk head-on, pain relief. And look, this isn't just about being comfortable. It's actually a vital part of your recovery. So, what do the experts have to say about it? First, let's get specific. We're talking about something called orthopedic pain. As you can see, that's any pain you feel after surgery or an injury to your bones, your joints, muscles. You get the idea. And it's a very particular kind of pain that needs a very particular approach.
Now, this right here is a really crucial shift in how to think about this. The goal of your pain medicine isn't to magically erase every bit of pain. No. The goal is to manage it just enough so that you can do the things you need to do to heal. Get good rest, start moving around a bit, and actually begin your rehab. So think of the pain management as the tool that makes all your real recovery possible.
And one of the most common tools in that toolbox is acetaminophen, which you probably just call it Tylenol. But, and this is a huge safety warning, a lot of people have no idea that it's also a hidden ingredient in hundreds of other medicines, everything from cold medicine to powerful prescription painkillers.
So what does this actually mean for you? It means you have to be vigilant. You have to be a detective. Follow those dosage instructions precisely. Check the labels of all your medicines, not just the painkillers, but the cold and sleep meds too. And look for acetaminophen. Never, ever take more than directed. And look, if you have any doubt at all, just ask your doctor or your pharmacist. It's that simple. Okay, so we've got pain management covered. Now let's pivot to that second major challenge, staying physically safe. This is all about preventing setbacks, and the absolute #1 focus here has to be preventing falls. Seriously, when you get home, this becomes your top priority, especially if we're talking about older adults. Above everything else, your goal is to prevent a fall, because a simple trip can mean a brand new injury, maybe even another surgery, and a huge setback to all that progress you've worked so hard for. So how do you actually do it? Well, it's a pretty straightforward 3-step plan. First, just understand the risk. Accept that your body is weaker, maybe a little less steady after being in the hospital. That's normal. Second, scan your home. Look for those little tripping hazards. Throw rugs, electrical cords, clutter. Make clear pathways. And third, ask for help. There is absolutely no shame in leaning on your family, using a walker, or getting a grab bar installed.
All right, we've covered a lot of ground, from medication safety all the way to fall-proofing your home. So let's pull it all together into one final, simple blueprint for your recovery. So here it is, your blueprint. Just remember these key things. Pain management isn't the goal, it's the tool that makes recovery happen. Always, always follow medication instructions. Be on the lookout for acetaminophen in all your medicines to avoid taking too much by accident. Turn your home into a no-fall zone. And finally, keep talking with your healthcare team. They are your partners in all of this.
And this brings us to one last really important question. This is vital information. So just take a second and think. Who in your life might need to see this blueprint? A parent, a neighbor, a friend who has a procedure coming up? Sharing this guide could honestly make all the difference in their recovery. Thanks so much for joining me.